Hello, my name is Ave Thomas. I'm the program manager for the Population Health Information Tool, and I'm joined today with Lisa Murray, who's the PHIT epidemiologist. The Population Health Information Tool is also referred to as PHIT. And together, Lisa and I work on the PHIT platform at the Department of Public Health in the Office of Data Management and Outcomes Assessment. We'd like to welcome you to our how-to webinar about using PHIT. That will include a basic overview of the tool while also providing a guide about how to use PHIT data through a population health lens. When we seek to reimagine data from a population health standpoint, it really allows the statewide data to be honed in to specific areas and regions that show how measures and outcomes are positively or negatively affecting groups within the Commonwealth. So what we'll be talking today, we have a brief outline of the things that we'll be discussing during this webinar. So the first thing that we're going to be trying to do is really getting a firm understanding of what PHIT is and the wide possibilities of its use. Then we're going to really transition to understanding how to run a data query for specific information, along with detailing outputs, limitations, and data significance. Next, we'll explore PHIT's community-specific social determinants of health reports, review data dashboards that supplement PHIT data sets, and then we'll also discuss some additional information that will allow users to make the most of PHIT. So we say PHIT, we say the Population Health Information Tool, but what are we really talking about? And as we said in the beginning, this webinar is really a how-to about how to use PHIT, but I think in order to really start at that place, we need to understand all the things that PHIT has to offer. So for some background, PHIT actually went live early in 2019. And the goal is to serve as a primary database, not only for people who work within the Department of Public Health, but also to give the general public access to a wide variety of data being collected across the state. In the past, DPH has had other systems like MassChip that were available to provide data, but with PHIT, the goal really is to provide context and framing of data with more descriptions of what the data actually includes, which can be viewed in each dataset landing page. In addition, not only does PHIT provide publicly accessible data, but it also allows users to create unique and specific dataset queries for population-specific information, while also formatting this data in downloadable files that can show maps, graphs, and tables. Now, although there is a large majority of community health data available and can be viewed in the form of datasets and customizable reports, PHIT takes the data really one step further by also looking at strategies to improve health, increase healthcare value, and frame a conversation based around social determinants of health. PHIT is really a two-sided interface that looks at both health data and into actionable approaches that can be applied to address community health needs. So how does PHIT work? As I transition the presentation to Lisa a little bit later, we'll talk about the large, immense amounts of data sets, but where does all this information come from? And so really all of this data in large part comes from a lot of the information we're getting from DPH epidemiologists. And so we're working with over 30 epidemiologists to actually gather information from a variety of programs and initiatives that DPH helps to facilitate throughout the state. They take that information and they format it to integrate it with the PHIT platform, and that standardizes really definitions and measures that can provide data in a readily accessible platform that you see in PHIT. You'll notice that when running data through PHIT, there can sometimes be some longer waiting times, and this is really due, in fact, that all of the data from all of our DPH programs live in the same database, and queries are really being pulled from specific data subsets, so that allows data sets sometimes to take a longer time to run. So you can see from this really pretty visual that there's a large amount of data, so ranging from hospitalizations to newborn hearing to births and deaths. And the data wheel really looks at our data sets that have been implemented in phase 1 of PHIT, which I said began in the beginning of 2019. In blue, those are the data sets that are already available in PHIT. In yellow, those are things that we're working on incorporating it into PHIT. And lastly, you'll see a section in orange that shows some upcoming data that's coming through. So really, we have about 75% of our identified data within the platform already, and then working on getting another 15% in. And so I know you're probably wondering, how do we decide on these particular data sets? So it was really a lot of conversation between the PHIT team, the core team, the epidemiologists and the needs of the public, and also the epidemiologists within the Department of Public Health. So from those conversations, we've gathered this information. But we like to say that we're really open to feedback. So as we have these types of workshops, as we continue to develop PHIT, we're open to understanding and hearing about additional resources and data sets that should be included in the platform. So now I'm going to direct us to our homepage. So our homepage can be readily accessible on mass.gov, and it has a really kind of good starting point, for us to visualize all of our data. So at first you'll see on our far left side is the data set directory. And so as I said previously, and as you could see in that wheel, there's a lot of information available. So if you click into this data set directory, which Lisa's actually going to go into a little bit later, you'll see a long list that will actually divide the data sets according to community level data, race and ethnicity, a variety of different factors that will allow you to kind of navigate through the data instead of scrolling down through all of the information that's available. You also see that we have a tab for our neonatal abstinence syndrome data, which is also a dashboard that we'll detail a little bit later. Health outcomes that can range anywhere from infectious disease to substance addiction. Health behaviors data, which also includes things like secondhand smoke exposure, kindergarten immunizations, and pregnancy risk assessment monitoring systems data. And lastly, our community reports. And so our community reports are something we're very, very proud of. And they do have kind of a dual name. So you'll see them here as community reports, but they're also known as our social determinants of health reports. So when we're talking about social determinants of health, and I'm going to transition back to our slides, but when we're talking about social determinants of health, we're really talking about 6 key aspects. And those 6 key aspects include built environment, education, employment, violence, social environment, and housing. And so I like to affectionately call it VBSHE because it's a lot of information to understand, but underneath this umbrella of social determinants of health, we've been really taking a strong approach to make sure that we're looking at social determinants of health and how it affects particular communities. And social determinants of health really do, from a DPH standpoint, have been something that we've been viewing as falling under the umbrella of structural racism. And so when we're taking into consider all of these factors, you're really going to be looking into identifying root causes that are affecting these 6 social determinants of health. And not only are we using this from a PHIT standpoint, but DPH is actually taking these 6 initiatives further. And we're actually partnering with a lot of hospitals to be using social determinants of health for community health needs assessment and for community health planning for large health systems across the state. So as we talk about social determinants of health, we can see that it really provides kind of the segue to how we're going to be looking at data. So I'm going to call Lisa Murray over, who is the PHIT epidemiologist, to really provide us with some context about how to look at the data and how to understand how to run data specifically within PHIT.
Thank you, Ave. As she said, I'm the epidemiologist for PHIT, so I'm really here to answer any questions you all might have as you're trying to navigate PHIT or interpret the data. I'm really here as a resource for you. So right now, I'm going to go back to our tabs that we have open and walk you through some of the more nitty-gritty of how to work through PHIT, how to get the data you're looking for, and answer some of the more common questions that I've been asked already. So we'll start with the social determinants of health reports, which is this tab right here. And for the sake of time, I've preloaded all of the tabs that we're going to look at because, as Ave said, there are some longer load times. So first here we have the PHIT community reports or the social determinants of health page. As you scroll down, you'll see we have developed a video that gives more context to people who are less familiar about social determinants of health, how they affect health, and things like that. So we definitely recommend watching that when you have time. Here we have places to access our 6 social determinants of health reports. As of now, we have kind of piloted our first social determinant of health report, which is employment. By the end of 2019, we should have all of the social determinants of health reports ready. For this webinar, we're just going to look at the employment report. So here I have the query loaded, and these social determinants of health reports are available at the community level. So Massachusetts has 351 cities and towns. You can scroll through and select the town that you're interested in. I'm interested in Quincy today, so I would select Quincy. The report would load. It would take a little bit of time, and you would come to this page right here. So we have an introduction. We have hyperlinks for health outcomes or health behaviors that are related to employment, and these go to other mass.gov pages, PHIT data sets, CDC data sets, things like that. One thing that you'll notice that might be take a little time to use is this scrolling iframe that we have within the overall page. So you'll scroll this to see all of the data that we have in these sections up here. So for the employment report, we have employment status, workplace risk factors, work organization, and work-related resources. So as you'll see, you can scroll through each section and it will show you a particular data point related to employment. It will have the town that you're interested in on one side or in one part in one color, and a statewide comparison as well. And the sources for all of the data points are different. Sometimes they're publicly available data sets, sometimes they're DPH data sets. In the case of the employment report, we have a lot of data coming from the American Community Survey and the Bureau of Labor Statistics, and a few DPH data sets as well. So as we're going through, you can see not all of the data sets will have the city comparison that you requested. Sometimes we only have available data available at the state. So don't be alarmed if you see something like that. Also, throughout the social determinants of health reports, as you're scrolling, you'll see inequity alerts. So as Ave was saying, we're using these as an opportunity to kind of direct the lens of DON and CHNA applications and things like that to look at structural racism and the history of what has happened to kind of lead to the health outcomes that we're seeing today. So inequity alerts will tell you when there might be inequities related to a nearby data point. And these all have citations as well if you want to know more information about those. And additionally, we have alerts about history in Massachusetts. I don't think we have one on this page, but they say history matters right here. So you can learn more, again, about how we got to the place that we are and why we're seeing the inequities that we're seeing. So if you're thinking about how to use these reports, there are a few options for you. One thing is you can just kind of use them as they are and make your own inferences from the data that you're seeing. One example that we've heard of came from a community health center in Quincy, who they looked at travel time to work, and they saw that comparative to the state, their residents had much longer commute times. So you can see in this graph, 45 to 60 minutes, much higher, 17.7% compared to the state at 10.3%. So that resulted in recommendations to have longer hours to accommodate those commutes. Alternatively, at the end of every social determinant of health report, we'll have these strategies that you can go to. So I've preloaded those. These also have accompanying citations, and they talk about different things you can try that might work in your community to address the inequities that you've seen in your report. So that's the social determinants of health reports. Again, they should all be ready by the end of 2019, hopefully. And all the citations you are looking for will be at the end of the report along with the conclusion. So now we'll pivot to the data queries themselves, which have a lot of details in them, so bear with me. First, we'll look at how to get to the data that you want. So we have this PHIT overall page. You would go to the dataset directory page, I believe it's this one. And your first option is to look at the table of contents, which have data grouped into different topics. As we scroll down, we can see there they are, and that will take you right to those topics. There are different data sets that repeat as they might fall under multiple categories, and you'll see some labeled as coming soon, so that's also a way to know what we have upcoming. That's the longer version of how to look for what you want. There's also a catalog of PHIT data that you can click. And there's a few different ways, depending on what you're looking for, to find what you need. So we have all the topics available right here under this drop-down, and all the subtopics as well. If you know you want data at a certain geography, you can use this to select only data that are available at the community level, maybe the county level. If you're looking for data on a certain age group, you can use this to see what's available. At this point with PHIT phase 1, we're data is in there in a limited basis, but we're working on building this out over time. So I'm going to go back to the dataset directory, and for the purpose of this webinar, I want to look at overdose, which falls under injuries in Massachusetts. So we would click the available now to go, to the injury page. And these landing pages are very important, and they will answer a lot of the questions that you have about the data. So the data stewards at DPH wrote all of this information that they thought was important for users to know. What is an injury? Details about the data are down here, additional resources about the data. And for all of these landing pages, when you want to go into the actual query themselves, there will be these buttons under key actions. So as I said, I want to look at drug overdose data. So I would click this, which will bring me to the query. The query pages will look different. They're in the same database, but the queries are all set up differently, so it just takes a little bit of patience to get through it. I'll show you, again, clicking through how there might be some quirks that you're not expecting or some time lags. You'll see this spinning wheel, and some of the feedback that we've gotten is queries take a while. I'll just remind you what Ave said, that there's a ton of data in this database, so it's sorting through and filtering through based on what you're selecting for your data, and that just might take a while. But eventually you'll have categories based on the topics that you picked. For this, we're going to look at emergency department visits. The spinning wheel will happen again. There might be situations where things will be pre-selected for you based on the data that are available. There might be situations where right here you only have one option, but you still need to click it. For some queries, you'll only have one page, and you'll click submit. For this page, there are 2 pages. So you can pick your geography that you're interested in. You can only look at one type of geography at a time, but if there are multiple subsets of each geography, you can look at multiple geographies within one. So you can look at multiple communities within the overall community selection, and you can either select all, you can scroll to whichever one you're interested in. I'll select all for this. And you kind of follow these red arrows to know what you need to click. It's important that you go in the order that the query is guiding you, because there will be different options as you select different items. So one thing to note, we have maps available with our queries, and as it says right here, the map will not display if you have different start and end years. So for this query, I'll select the same start and end year of 2014 so that we can see the map. At this point, I'll go into the query that I've preloaded to show some of the details. So every query will start with a data table at the top, and it will just remind you of all of the selections that you picked and the data that you're looking at. So we have drug overdose, specifically heroin overdoses, and emergency department visits. This is our year. We're looking at all sexes, all races and ethnicities, and all ages combined. So first for the map, the legends are in this little legend tab. So if you're wondering what the colors mean, it will tell you right here. So yellow is essentially worse health. So they're seeing more emergency department visits for heroin overdoses. Blue means they had no emergency department visits, and white means there's no data for that community. So you can see kind of how your town is doing compared to towns around you, see where the hotspots are within the state. The other great thing about these maps is we have multiple layers that we have included from MassGIS. So there are different types of zones that you can kind of overlay to see what else is going on in the community that you're looking at and provide more context. You can look at, you can, ignore certain things, add different layers, like this has paths, and it will load for you to zoom into and see all of the options that you have. Not that that would necessarily relate to overdoses, but that's relevant for other data. So then I also want to point out that you can export the data output that you have down here, either to CSV or to Excel. And when you click these buttons, it will open a new window, and the download will be available at the bottom of the window. So here we have the data output, and this is for all communities for the year 2014. And at this point, I'm going to go over a few technical details. These are kind of the most popular questions that we're getting about the output, so hopefully we can answer them for you all here. Definitely be aware that all of the outputs will be different. They won't all have the same types of information available, but this injury overdose data set has pretty much all of them in one place, so it's a good one to look at. So we'll just move left to right. We have the geography we selected. In this case, it's community, and we have all communities. We have the year that we selected. We have the population. So one thing that it's kind of hard to get your head around if you're not used to working with statewide data is that population estimates are estimates. So as you can imagine, people are constantly moving in and out of different communities of the state. People are being born, they're dying every day. So it's impossible to have one accurate estimate for the population for an entire year. So they are estimates. And these estimates will change based on the other geographies and selections that you have. So we're just looking at the entire community of Abington right here. If we were looking at just males or just people from the age of 25 to 35, that population will change. Then we have the case count. And the case count is just the absolute number of events that this population saw over the year 2014. So part of the reason that we have some lags in when the data are available is because we want to spend a lot of time making sure that these case counts are accurate, because all the information, all the rates that we calculate are based off of these case counts. So they're very important. So we spend a lot of time validating everything that happened and everything that's reported. Then we have our rates. And there are two different types of rates in this data set, and there will be other types of rates in other data sets. We have the crude rate and the age-adjusted rate. And this crude rate is just the number of case counts divided by the population. And these rates are presented per 100,000 people. So this is so that we can standardize rates across cities, so that we're not just looking at the case counts, because it's kind of hard to compare a smaller city to a larger city. You will expect a larger city to have more case counts. So that's why we like to use the rates that are standardized per 100,000 people. And even if a community is smaller than 100,000 people, it will still be calculated up to 100,000 people so that you can compare it to all of the communities. So we have the age-adjusted rate, which, if you're not familiar with statistics, it's just a more balanced rate based off of the distribution, the age distribution in that population. Then we have our confidence intervals. And a confidence interval is based on the number of cases or events that happened in a community. They're based on the number of information. So if there are more cases, there's more information for a community. And so that will result in a narrower confidence interval that is more precise. So these confidence intervals give you a range of what was the actual kind of expected rate, or you could even think of it as kind of a health situation in a community. And these are very important because we use them to calculate our statistical significance tab, or column rather, which is here. So the rate in a community can either be statistically significantly higher, statistically significantly lower, not statistically significantly different, or not shown. And these are determined by this confidence interval. And if it overlaps all the way down here with the confidence interval of the state. So if the upper end of the confidence interval is, for the state, is lower than the lower end of a confidence interval for a city, it will be statistically, the city's rate will be statistically significantly higher than the state, and that's what we see right here for Abington. The following column is stability, and this is just calculated, this is just based on the standard error of the calculation. So it's similar to the confidence interval. A narrower confidence interval will be more stable. So if there's nothing here for stability, you can assume that it was a stable calculation. If it's unstable, that means that there were very few case counts, and so you should be cautious. You might have a very high rate or a very low rate calculated for a community, but if it's an unstable rate, that's not necessarily something you want to depend on to say, wow, something is really great or really bad happening in this community. And again, I'll just remind you that there are a lot of technical details in these outputs, so please reach out to me, the PHIT epidemiologist. We'll have the contact info later in the presentation if you have any questions at all about kind of what this means and how to put it all together. And then the last thing I'll point out with these data sets is this NS, which means not shown. So in TPH, we have different rules for different data sets about suppressing data. We suppress data that are small counts for communities to protect the information of the residents in those communities, because people don't want to be able to be identified from a public query on a Massachusetts website. So the rules are different for each data set. You'll see right here this go to footnotes button. This is just at the bottom of the query, you'll see. And it will tell you more about the data sets, more about the nitty-gritty things that you might want to know. So it tells you what unstable is, it tells you the type of confidence interval, and here we have that the statistics are suppressed to protect confidentiality when the number of cases is less than 10. So that'll be different for each data set, but one thing that's important to know is that doesn't apply to a zero count. So a zero count will still result in an unstable rate, but if zero things happened, then there's nobody's data that we need to protect. I think that's everything for the data query. So we will move on to a different way that we could have run this query, which is just multiple years. So just pointing out that there's no map when we selected multiple years. And we also, you can just select, you can do control click to only select a few communities if you want to only look at a few communities. Here we have Boston, Brookline, Springfield, and Worcester, all from 2007 to 2014. And then we'll also show you the state's data from 2007 to 2014. So it's helpful to look at trends over time to see if your community is improving, if things are getting worse, and things like that. So next we'll go on to the data dashboards, which come from this picture tab right here. It will bring you to the neonatal dashboard landing page. And these at first are similar to the other PHIT queries. They have important information that you would need to know. They talk about different definitions, pregnancy, neonatal, things like that. Currently, the neonatal abstinence syndrome dashboard is the only dashboard that we have, but there are many that are upcoming, so look out for those. Similar to the queries, you'll click this button to go to the dashboard. And for this one, we just have data available statewide. So you'll use these buttons up at the top to work through the dashboard. You'll use the slider down here to kind of look at different rates throughout the years, but you'll have this line graph to show you all the data that we have in there. Then you can group the data differently. So it will change the rate for these different groups that we have predefined. It'll take a second to load. These groups have different column graphs that will show the disparities between any groups, if there are any disparities, their changes over time, and there's a legend if you need that information. So for all of these groups, you'll have column graphs that you can refer to for your visualizations. For EOHHS regions, there's a map that you can use to reference with colors. A darker color is kind of more severe for whichever indicator you're at. Throughout the years, those colors will change, so that's a visual aid as well. Then we have our subtopics up here that have different indicators under these drop-down bars. So you can go through, look at how the state's doing in terms of neonatal abstinence syndrome. If you have questions, hopefully they will be answered by this. If you want to know more about the data, you can click about these data. And similar to the queries, there are important footnotes at the bottom. So that's everything for the PHIT queries, the dashboards, and the social determinants of health reports. If you looked through PHIT, you know what you need and you weren't able to find it, we do have a couple of aids for you. So let's say you were looking for specific death data. You went to the death page, you went to the death query, and you either were having trouble or you weren't able to find what you needed. All of the pages will have links under additional resources for how to use the population health information tool and how to request additional PHIT data. So if we go to how to use the population health information tool, this is just a user's guide that's shorter than this webinar, but has most of the same information. How to view, downloads, our contact information. So if you go to more info and you are sure that you use the tool right and the data that you need are not available, you can go here, which is the same link as the how to request additional PHIT data that we saw on the death page. And we've developed a form to request additional data. And it's a very big form, so it needs to be downloaded to your computer and filled out on your computer and emailed to the PHIT email. And so the process, I can just walk you through it here, but it's also written in the instructions. You'll right-click this link for form to request additional PHIT data, save link as, and you'll save it on your computer. I'll just click save, and you would open it on your computer and fill it out and email it in. If you have any questions about that form, if you have trouble downloading the form, I can email it to you, or I can walk you through it. There's a lot of options in those forms, but just know that there's a lot of data in PHIT, there's a lot of data that doesn't necessarily exist that you might want. So as I said, it takes a while to validate additional years because we really want to make sure that those data are accurate. So if it's 2019 and you're requesting 2019 data, that won't be available. 2018 might not be validated yet. The same could be true for 2017. So just don't get too excited, I guess, when you're filling out that form, because what you want just might not exist. So that's everything about the PHIT website, the queries. I think I'll just wrap up the presentation with our contact info. If you have any questions, here's our contact info. So if you have any questions, please don't hesitate to reach out to me, Lisa, the PHIT epidemiologist, or Ave, who was presenting earlier. We really thank you for watching this webinar and for taking the time to learn more about PHIT and to use our health data to improve the health in your communities. Thank you.